नमस्कार मंडळी. किशोरवयीन मुलांच्या तब्येतीबद्दल रायगड IIP तर्फे सप्ताह चालू आहे. डॉक्टर दाभाडकर सर, डॉक्टर किरण वासवानी, डॉक्टर निलिमा भंडारकर यांचे योगदान आपण सर्वांनी आतापर्यंत बघितले. पण आजचा विषय आहे सर्वात महत्त्वाचा, तो म्हणजे मनस्वास्थ्य. This year theme for Adolescent Week is transition, badlav. From age 9 to 19 years, there is a transition in teenagers. It may be physical, mental, and sexual. Today, we are focusing on mental issues. मानसिक स्वास्थ्याबद्दल आज आपण चर्चा करणार आहोत. पण त्याआधी आपण सर्वांचे स्वागत करण्यास मी आमंत्रित करते रायगड IIP प्रेसिडेंट डॉक्टर प्रमोद वानखेडे यांना.
थँक्यू मॅडम. थँक्यू व्हेरी मच. गुड इव्हनिंग डिअर ऑल रिस्पेक्टेड सिनियर्स. डॉक्टर दाभाडकर सर, our Maharashtra IIP President Gangulia sir, Chitra madam, Neha, our digital boy Dr. Vishal, and all the dignitaries, Dr. Barne, I'm seeing on the board, Dr. Sampath. As you know, this is the last activity of our Adolescent Week celebration and of Raigad, IIP Raigad. And we are ending up with a very nice talk by Dr. Shubhada Khirwadkar ma'am. Dear friends, adolescence period is the most impulsive, vibrant, risk-taking and enthusiastic period of life. We need to keep them, this adolescent, on the right track. For that, the role of pediatrician, role of adolescent pediatrician, counselors, teachers are very important. We need to know them thoroughly. We should know their mental status, particularly in COVID period when schools and colleges were closed, outdoor activities was not there. त्यांची घुमसट आपण पाहतो, त्यांची कुचंबणा आपण पाहतो. ऍक्च्युली इतक्या व्हायब्रंट एज मध्ये त्यांना घरात कोंबून ठेवण्यासारखं दुर्दैव नाही. पण now sometimes they get psychologically disturbed, they become violent, sometimes they get depressed, sometimes they become arrogant. So dear friends, pertaining to this situation of adolescence in COVID period, we are having today's discussion, and we are having a very eminent adolescent pediatrician from Nagpur, Dr. Shubhada Khirwadkar ma'am, with an adolescent expert from IIP Raigad, Dr. Chitra Kulkarni ma'am, as a moderator. Dear friends, to make this discussion more interactive, interesting, you just collect your questions, ask them, so that the session will be more interactive. Without wasting time, I just hand over to Chitra ma'am. Thank you very much.
Thank you. And may I request again for all non-participants to be on mute mode. Dr. Sasane sir, Dayanand, and one more Zoom. I request again to keep mute audio for next 1 hour. Thank you, sir. Now may I request our AHA Raigad President, Dr. Dabhadkar sir, to say a few words.
Hello, good evening everybody. My friend and Maharashtra IIP President Dr. Hemant Gangulia, my beloved friend and Raigad IIP President Dr. Pramod Wankhede, today's faculty Dr. Khirwadkar madam, today's beginner Dr. Chitra Kulkarni, Neha, and dignitaries and friends. I don't want to take much more time because I am outstation now and probably my voice may disturb you. बट मैं आपको एक बात बोलना चाहता हूँ कि अपने हर एक आदमी में एक बच्चा छिपे वाला होता है, वो शायद एडोलेसेंट हो कुछ ना हो, वो बच्चा वी शुड प्रिजर्व दैट चाइल्ड, अवर चाइल्डहुड. ओके, एज गुलजार सेड, ये जिंदगी वो छीन सकती है बचपन मेरा बचपना नहीं. ऐसे time when we have adolescent, then we are the proper person now. How we can advise our children, our patient, our adolescent population that how they should behave, what are norm, what are normal guidelines, what they should do and what they should not. I'm so happy that one of the dignitaries, one of the authorities in adolescent medicine, Dr. Shubhda Khirwadkar from Nagpur, she is here. I welcome Dr. Shubhda Khirwadkar on behalf of Raigad AHA and Raigad IP, and I wish you best luck for this program. Over to Madam Chitra Kulkarni.
Thank you, sir. May I request Maha IIP President Dr. Hemant Gangolia to give away blessings for the present, his parent branch. Please say something.
थँक यू मॅडम. सर्वांना आजचे उत्कृष्ट वक्ते मॅडम शुभदा, आपले टॉवर ऑफ इन्स्पिरेशन डॉक्टर दाभाडकर सर, डॉक्टर चित्रा मॅडम, डॉक्टर वानखेडे सर, आपले रायगड आयपीचे प्रेसिडेंट, सर्वांना, डॉक्टर नेहा सिंग, डॉक्टर दयानंद, डॉक्टर संपत, सर्वांना माझा नमस्कार आणि शुभ सायंकाल. आणि हे खरोखरच आपली आज शेवटची ऍक्टिव्हिटी आहे या वीकची आणि चांगलेच कार्यक्रम आपल्या आयपी रायगडने केलेले आणि ह्या कार्यक्रमास माझ्या हार्दिक शुभेच्छा आणि नक्कीच हे कार्यक्रम छान होईल अशी मला वाटतंय आणि ते म्हणून धन्यवाद. थँक्यू.
Yeah, thank you all the dignitaries. I could see Dr. Kiran madam, Dr. Bharne, बहुत सारे dignitaries आज हमारे साथ जुड़े हुए हैं. Dr. Jayashree also. I acknowledge the presence of Mr. Amresh also. Thank you so much. देखो आता आपण असं म्हणू की वेद आणि पुराणांमध्ये आपण बघितलंय की सत्ययुग होतं, मग त्रेतायुग, मग द्वापार युग आलं आणि सध्या चालू आहे कलियुग. त्यातील या कोविड पॅन्डेमिक मुळे आलेलं स्ट्रेस युग सगळ्यांना अतिशय त्रास देत आहे. आता याला आपल्याला कलियुग म्हणायच्या ऐवजी स्ट्रेस युग म्हणावं असं वाटायला लागलंय. सो दिस इम्पॉर्टंट सेशन is about mental health. And we are having an enthusiastic senior AHA member from Central IIP, Dr. Shubhda Khirwadkar. May I request Dr. Wankhede sir to introduce her. Neha, please share Dr. Shubhda madam's slide. Sir, you are on mute. Dr. Wankhede, you are on mute mode. Please unmute.
Hello. Ha, madam. Neha, please share the slide. Yes. Shubhda Khirwadkar, madam. She has done MD Pediatrics from Government Medical College, Nagpur, and she also did MA in Clinical Psychology. Madam is the national convener of Nurturing Adolescents in Schools. That is the AHA activities. She is the executive board member of Adolescent Health Academy 2021. And she is a past president of Adolescent Health Academy Nagpur and IIP Nagpur also. She is a director of Tender Buds, a child and adolescent care center Nagpur, and director of Sehat project for tribal adolescent. At present, she is working there, I think. Then she is a national and scientific journal. She has got many articles in national scientific journals and parents and teacher educational publications, books and newspapers, columns. And she has got many programs on TV and radio programs on understanding adolescence and childcare and parenting. She is awardee of best work for adolescent health, Adolescent as Khajuraho in 2017. 16 national awards as a president IIP Nagpur she got. And she bags 4 gold medals in MA in clinical psychology Nagpur University in 2004. And she has got honors in pediatrics in final MBBS examination 1987. She took hundreds of workshops and talks, more than 100 workshops on parenting, more than 200 workshops on adolescent and life skills, and teachers training workshops on nurturing adolescents. So many list is endless. It is difficult to elaborate everything at this moment on board. So I just cut it short, and at last, and one more introduction is that she is my batchmate and my friend. Thank you very much.
Thank you. Over to Shubhda ma'am for her presentation. Will you try to share or shall we share?
Continue with this. It is okay.
Okay. Dr. Neha, next slide, please.
Right. So, a very good evening to all of you from IIP Raigad. And as I have been seeing for past 15 minutes, तुम्ही सगळे मराठीत बोलताय, सो मी पण मधून मधून मराठीत बोलण्याचा प्रयत्न करणार आणि I will try to make this presentation as interactive as possible so that we all can have a discussion on what we can do for our adolescents in the next few months or few years, so to say. So we have all seen ourselves how there have been so many pandemic blues, and we now have to think about how we can adjust to the new normal. We are already in the process, but we are now going to see many more transitions in our lives and in the lives of adolescents in terms of adjustments to the once familiar schools. Now they are going to go in person. They are already there, and I am hearing from many of the teachers how much they have lost in the past 2 years. How we are going to address this transition, how we are going to address the fears and distress that the parents have been facing themselves because of the various losses in pandemic, and we as a caretaker or a caregiver of our children and adolescents, what we as pediatricians can do so that this transition becomes more smooth. I request, yeah, okay, next one please. Hello, yeah. So if we try to define the magnitude of the distress that this pandemic has caused, all of us know this, but just to put this in perspective, we have to think of 5 M's. So the first thing is the mind. Just as this pandemic has created lot of issues with our physical health, it has equally affected the mental health, especially of children who were not only stuck in their homes, they were devoid of so many normal things in their lives. And also the adolescents who were on the verge of a new career, say maybe 10th, 12th, or in the process of admissions to a professional career or course. So they have been all facing lot of distress. We'll discuss the various issues in detail later on. The milieu itself has created so many issues for the adolescents because the nurturing environment, the way of exploration which was common for them in their age of adolescence, that is the schools, were closed, and therefore the common way of exploration and innovation that these children and adolescents were familiar with have not been there. So to say, the enriching environment that is required for adolescent development in that particular age especially was not there for past 2 years. Meals were affected in both ways, more junk, and for the children who were underprivileged or were living in remote areas, the meals were lost in terms of midday school meals and also because of the financial distress and poverty. In terms of mechanics, the way the schools were run on screen and the gadgets were used for unlimited period of time, this mechanics also affected the way of living of our children and adolescents. And many of these, almost 30% people from rural areas and tribal areas migrated, and we cannot imagine how much distress this out of school children who probably have lost their hope to connect to school again have been affected because of the migration. Next, please. So COVID-19 pandemic, of course, we are hearing about the various versions that are still going to come. So we know that the virus is going to stay with us. But we also know that we have become islands of me. That is, many of the children and adolescents were living in protected environment and therefore have become more selfish, more pampered, or maybe more isolated. There is change in place and people now, and we are seeing so many children who the teachers are reporting are not interested in the usual academics and curricula, and the parents have anxiety about their future. There is still a lot of instability and uncertainty as to how their life is going to be normal in the coming days. We are all worried whether we have lost a critical period in the lives of our children. Next one, please. So if we try to remember what these children are, please click again. What are they going through? So there were many lost opportunities in terms of learning. Next, please go on clicking. There is fear of disease, separation, and many of the families also face bereavement because of death of their near and dear ones. There is difficulty in coping with uncertain future. There is frustration, irritability, anger, violent changes in mood, and many homes face lot of domestic abuse, husband, wife, and also from the parents towards children. Lot of loneliness, grief, loss, and concern for academics and career. Another important thing was the parental expectations have now begun to rise so much that they feel that the child or adolescent who had lost the critical period or the critical learning curve now has to catch up, and he or she has to do it very fast, otherwise the loss will increase. And therefore I am seeing, and I am many children and adolescents are being referred to me who are facing violence and abuse at home, not only in terms of physical abuse, but lot of abuse of imagined expectations. So the next slide, please. So now they're adjusting slowly to the unfamiliar school. And it has been a nightmare, but we also have to look at the positive side, because if we want to move forward, we have to take both of these negative and positive effects together. अगर हम ये साथ नहीं लेंगे तो फिर हमारा ज्यादा मुश्किल रास्ता होगा. तो हमारे साथ proxemics और kinesics, दो वर्ड्स आप देख रहे होंगे. Proxemics is coming near and kinesics is the movement. So both bonding and movement have probably increased inside the home. The family has come to know each other in a better manner. There might be less anxiety because there were more avenues of knowledge in terms of screen education and more options to deal with. So lot of hybrid learning, innovative ways in which we can educate ourselves, ways in which we can connect to each other have also schooling. There are newer methods of learning which have emerged and which have helped children at least to remain connected to their schools. Next one, please. One more click. So body, mind, emotions and behavior all are affected. Body in terms of, because many children do not verbalize their physical ailments or their emotional distress, and we have to look at these symptoms as probably a cause for their psychosocial distress. So headache, backache, sleep issues, gain or loss in weight, difficulty in attention, lot of fatigue, performance drops, and many children, especially in online classes, the teachers were reporting that they are showing truancy, they have become defiant, they have devised new ways of just logging on the screen और वहां से और कुछ करना, दूसरी कुछ इसमें लग जाना, screen यहाँ चालू रखना. So they have devised newer methods of being truant. Many of them were afraid, irritable, angry, or sad. And we now have to look at coping. एक IAP का हमने सर्वे किया था, उसमें दिखा था कि almost 75% of the homes have reported stress. And I am speaking not only of stress towards children, but stress of parents also. Next one. Yes, next. तो अगर बच्चे का या एडोलेसेंस का हम ऑप्टिमम ग्रोथ चाहते हैं तो हमें ये 5 चीजों का ध्यान रखना पड़ता है. फर्स्ट इज सेफ्टी. एवरीवन नोज how we have to look at safety of our adolescents in terms of abuse on screen, bullying in person, abuse of various substances to reduce their stress, and how they are going to cope with the new normal. Security issues are there in terms of whether the environment in which they are living would be secure in terms of financial assistance, money, the requirements that they have in their daily needs. Nutrition, of course, all of us know how important it is. Another important feature is an enriching environment. और उतना stimulation उनको घर में मिला कि नहीं ये भी हमें पता नहीं है. Many of the adolescents do not know how to seek health care on their own unless their parents bring them to the clinic. They do not have any way in which they themselves can seek help for their health. हमारे यहाँ हम ये नहीं देखते पर in many countries it is a common practice that adolescents above 12-13 years they go to their doctors, their family doctors or pediatricians on their own without their parents being in tow. अगर ये नहीं है तो फिर बहुत बार उनके जो अंदर वाली बातें रहती है they are not able to express in front of their parents. And for adolescents this is especially very important in terms of addictions, in terms of their psychosocial distress, and in terms of distress coming out of the peer pressure or breakdown in their relationships and so on. तो अगर एडोलेसेंट्स को अपनी आइडेंटिटी बनानी है, उनको सही एक्सपोजर मिलना है और वेज ऑफ एक्सप्लोरेशन मिलना है, ये कैसे मैं आगे देखूंगी. अगर ये मिलना है तो दे नीड ऑल द 5 थिंग्स towards their optimum growth. We have seen how irresponsible the media has been for the past 2 years, how they have done so many abuses on screen because not only the media was showing shamelessly many things which created a turmoil in the minds of children and adolescents, and also in terms of how they themselves were abusing the media for things which they should not have seen during this period. Yes, next one. एक हमें और चीज देखनी है, एडल्ट मेंटल स्ट्रेस भी बहुत बढ़ गया है. We have to consider this because they are the primary caregivers for our children and adolescents. और अगर उनको स्ट्रेस है तो automatically that stress is going to go to their children. So a lot of adults reported difficulty in sleeping, eating, substance abuse worsened, chronic conditions also worsened, and many of them also, almost 28%, have shown some kind of depressive symptoms during this period. Next. Yes, next. अभी स्पेसिफिक साइकोसोशल इश्यूज क्या हो सकते हैं, ये तो हमने जनरल बात की, लेकिन one before that, please click the previous one. Hello. Yes. तो स्लीप डाइट डिसऑर्डर्स तो हमने देख लिए. अटेंशन और लर्निंग का क्या करें? मेनी ऑफ दीज चिल्ड्रन 5% ऑलमोस्ट हैव इश्यूज ऑफ अटेंशन इवन बिफोर द पैंडेमिक. तो स्क्रीन के बाद तो उनका अटेंशन और भी डिफिकल्ट हो गया. Many new children have discovered that they have learning difficulties or disabilities once they attach themselves to the screen. And pain, aggression, mood disorders, anxiety disorders, panic attacks, especially if they are asked to go to their tuition class or to their school, addictions, and two very specific diseases that I'm going to discuss in terms of a case later on is PTSD, that is post-traumatic stress disorder, which I think is going to be a long-term effect, and we are going to see a lot of cases in coming 1 or 2 years. Screen, cyber abuse, and social media abuse, phone abuse, all of these have also increased. So these are specific things which we need to look at. हम अगर पीडियाट्रिशियंस इसके बारे में अवेयर होते हैं तो हम अर्ली वार्निंग साइंस के लिए ढूंढेंगे. अगर ये हमें पता नहीं है कि ये चीज के लिए क्या देखना है हमें, तो वी विल नॉट बी एबल टू catch them early and give them appropriate referral or treatment. Next. But as I have said, there are many benefits from this screen learning also. Children have now learned collaborative learning. एक साथ जुड़ के कैसे करना है, blending of knowledge क्या होता है, useful apps है, tools है, वो teachers ने पूरे 2 साल use किए, so now they are continuing. So it is going to be a lot of hybrid thing which we are going to see with Padlet, Seesaw, Boom Card, ये सब tools है ये जो teachers और students use करते हैं. And one important feature I think which has made the children more resilient and more adaptive to the new situation is the altruism, that is helping others, which COVID has taught them to support others. Also, we are seeing many children who were shy, were not able to express themselves, are very smart on the screen, and we are seeing lot of talents which were not previously showcased now being done. Social anxiety, shyness, loss of self-esteem or reduced self-esteem is not seen on the screen because screen is a friend to them and they are not very much conscious of the people around. But maybe this could be a reason for worry when they are going to meet people in person and they are going to lack social skills. And screen has also become a platform for advocacy. और अगर हमको, हम सब पीडियाट्रिशियंस, केयर गिवर्स, स्कूल, पेरेंट्स, अगर हमको इस चीज के बारे में सोचना है कि किस तरह से हम बच्चों का और या एडोलेसेंट्स को हेल्प कर सकते हैं, तो एडवोकेसी इज द बेस्ट वे in which screen can be used to connect to lot of people all across the globe and share how they have used their experiences in taking care of these children. So maybe we are going to see a tougher, more resilient generation next. So do not worry too much, but just be more alert and more aware. Yeah, next one. All the parents have now realized that just as home is a paradigm of mental health, school is also one of the ways in which we are able to address mental health of children and adolescents, because they not only connect to each other and learn both curricular and co-curricular skills, but they also have food for their body and mind in school. They can explore creatively, get stimulated, and they have a structure in their daily routine which is absolutely essential if we want to give a sense of security to our children. साइकोसोशल ग्रोथ के लिए भी स्कूल कितना इम्पोर्टेंट है अब ये पेरेंट्स को पता चल गया है. So now the schools have reopened and that's a great news for the growth and development of our adolescents. So next. नॉर्मल चिल्ड्रन के लिए तो ग्रेट न्यूज है ही, बट जो बच्चे ऑटिस्टिक है या फिर लर्निंग डिफिकल्टी जिनको है, या ADHD है, या और कोई मेंटल इश्यूज है, उनके लिए स्कूल का खुलना ये बहुत ही चैलेंज बच्चों के लिए बहुत ज्यादा इम्पोर्टेंट था। एंड हमारे IAP के इतने सारे पीडियाट्रिशियंस के एडवोकेसी के कारण Dr. Piyush Gupta and everyone who were on board continuously helping the school and continuously telling the government that they must reopen fast has helped. Parents and teachers are also happy, and probably the community life is slowly going to get back on track. Next one. New learning हमेशा एक challenge होता है. Yes, please go on clicking. Yes, ma'am. Neha, ma'am. Hello.
Yes, ma'am. Yeah.
Just as there are positive and negative impacts, there are lots of confused reactions. यानी कहीं पर भी बात होती है तो हम सब उनके डिस्ट्रेस, डिसऑर्डर्स और उनका कैसा बुरा हो रहा है स्क्रीन के कारण, स्कूल बंद होने के कारण, इसके बारे में सोचते हैं। पर हमारे पास कितने सारे पॉजिटिव रिसोर्सेस है, इसके बारे में अगर हम सोचना चालू करेंगे तो then we definitely have a positive way to move forward. Yeah, next. So we are all going to have newer roles. We will all have to don newer hats. अलग-अलग चीजें हमको खुद सीखनी पड़ेगी so that we will be able to take better care of our adolescents. So what are these? There are of course going to be limitations, but we are humankind is a race which has always crossed all their limits. So we are going to dodge them, or we are going to avoid them and move over from the obstacles. Next one, please. So अगर हमको न्यू सिचुएशन को एडजस्ट होना है तो हमको खुद के रिसोर्सेस, हमारे सपोर्ट सिस्टम यानी स्कूल, पेरेंट्स, डॉक्टर्स, इनके रिसोर्सेस स्ट्रेसर के साथ जुड़ा कर देखना पड़ता है. फिर देन वी कैन डिटरमाइन whether we are going to go into a crisis or we are going to be more fluid. यानी हमको चेंजेबल रहना है, फ्लेक्सिबल रहना है. At least for now we are not going to focus too much on academics. We're going to focus more on empathy, on knowing our children, what they are going through, and giving them lot of concessions and letting them go at least for few more months, so that they are not facing our emotional abuse when we are trying to take care of them. Academic institutions will have to make lot of changes to bridge the learning gaps, and maybe in revision classes और बहुत सारी चीजें उनको करनी पड़ेंगी. Yes, next one please. So we need to build resilient, यानी चिवट जिसको बोलते हैं ना कि bounce back from the distress. ऐसे बच्चे who are more independent, autonomous, self-caring, who are grateful for the things that they have, and they are able to tide over the learning gaps and have their own self-care structure. ये कैसे करेंगे हम बाद में देखते हैं. Yes, next one please. तो ये एरिक्सन नाम का एक बहुत बड़ा साइकोलॉजिस्ट जिसने एडोलेसेंट्स के साथ काम किया है, और इन्होंने 2 स्टेजेस एडोलेसेंस की बताई है. One is stage 4, which is important for adolescents, that is whether that adolescent is going to move towards industry, यानी वो कुछ प्रोडक्टिव कर पाएगा या खुद को बार बार इंफीरियर ही समझेगा. ये हमारे उनसे किस तरह के इंटरेक्शन होते हैं इसके ऊपर डिपेंडेंट होता है. प्लीज गो ऑन क्लिकिंग. So they always need approval from us. कोई भी छोटी सी भी चीज अगर वो कर लेते हैं तो we have to constantly profusely appreciate them, because not because we want to make them happy all the time, but just to make them sure of themselves, to make them more confident, because this is the stage 6 to 12 years when they are looking at the world as a world which is going to give me warmth, a world with which I can share my thoughts, and the world with which I can connect. So if this is happening at homes and schools, and many schools have devised beautiful ways in which they have welcomed the children back to school. Similarly, parents have to learn, and we have to teach our parents how we are going to appreciate our adolescents so that they become industrious and not inferior in their confidence. Next one, please. तो ये स्टेज इंपॉर्टेंट ध्यान में रखनी है. दूसरी स्टेज है आइडेंटिटी वर्सेस रोल कंफ्यूजन. ये बहुत ज्यादा जार्गन में मैं नहीं जाऊंगी, इसका इतना ही मतलब है कि हु एम आई इज अ कांस्टेंट एक्सप्लोरेशन ऑफ द एडोलेसेंट. और अगर उसको अच्छा एक्सपोजर मिलता है, जो अभी मिलने लगेगा स्कूल के साथ, अगर उसको एक्सपेरिमेंट करने में, ट्रायल एंड एरर में गड़बड़ हो जाती है, मिस्टेक्स हो जाती है, कभी वो उसका पैर फिसलता है, तो कमिंग बैक के लिए जो रेजिलियंस लगता है वो उसको होम सपोर्ट सिस्टम से मिलता है कि नहीं, इस पे वो डिपेंडेंट रहता है कि वो खुद का आइडेंटिटी बना पाएगा या नहीं. अगर उसके डायरेक्शन ऑफ लाइफ को सेंस देना है तो उसको खुद के फिजिकल, सेक्सुअल, वोकेशनल और एथिक्स और वैल्यूज, इन सब पे काम करना पड़ेगा. और उसमें उसके टीचर्स, उसके डॉक्टर्स और उसके पेरेंट्स तीनों भी उसको मदद कर सकते हैं. आप ये सोचेंगे कि हमारी बिजी ओपीडी में हम ये कैसे कर सकते हैं, बट वेन एवर एन एडोलेसेंट 12 ईयर, 10 ईयर और मोर comes to you in the clinic, just ask him 1 or 2 questions about his school or about his home, and you give a question, you have some doubt that the answer is not appropriate or according to your expectations, just spare some 15-20 minutes and ask his parents to send him back to your clinic so that you can probe more. Next one, please. तो ये एक चार्ट है जिसमें हमें समझता है कि एडोलेसेंट अपनी अच्छी सेल्फ कॉन्फिडेंट आइडेंटिटी बना पाएगा कि नहीं. इसमें दो एक वर्टिकल है और एक हॉरिजॉन्टल है. कमिटमेंट टू एनी टास्क दैट ही हैज टेकन एंड एक्सप्लोरेशन दैट इज फाइंडिंग न्यू वेज ऑफ डूइंग इट. अगर कमिटमेंट हाई है पर एक्सप्लोरेशन बहुत ही कम मिला, यानी उसको चांसेस नहीं मिले, अपॉर्चुनिटीज नहीं मिली, तो लेटर ऑन व्हेन ही इज चूजिंग अ करियर और इज चूजिंग अ पाथ इन हिज लाइफ, उसे ऐसे लगता है कि आई हैव मेड अ चॉइस एंड देयर इज नो गोइंग बैक एंड आई एम नॉट गिवन मच थॉट टू व्हाट आई शुड हैव डन. अगर उसका कमिटमेंट भी लो है और उसको अपॉर्चुनिटीज भी लो मिलते हैं तो वो कंफ्यूज रहता है ऑल द टाइम एंड उसको ये नहीं समझता व्हाट आई एम सपोज टू डू विथ माय लाइफ. अगर उसके कोई भी गोल के तरफ या टास्क के तरफ या उसकी जो पैशन है, हॉबी है या कोई इंटरेस्ट है, उसके तरफ उसका एक्सप्लोरेशन अच्छा है लेकिन कमिटमेंट लो है, तो वो बार बार यही बोलेगा कि मुझे समझ में नहीं आ रहा है, आई एम थिंकिंग ऑफ दिस एंड लेटर ऑन थिंकिंग ऑफ दैट. So that is called as moratorium. लेकिन अगर उसकी कमिटमेंट भी अच्छी है, जो पेरेंट्स एंड हिज केयर गिवर्स कैन टीच हिम, एंड उसका एक्सप्लोरेशन भी बढ़िया हो चुका है, he has tried many different paths and then come to a conclusion, चांसेस उसको ज्यादा मिले हैं, तो उसको आइडेंटिटी अचीव करने में ईज होती है. इस कोविड के दौरान ये थोड़ा गड़बड़ हो गया था. So next maybe 6 months, 1 year, we will have to look at these two stages that I talked of, 6 to 12 years and between 12 to 16 years, जहाँ ये पूरा identity achievement होता है. Next, एक केस हम लेते हैं जो मैंने recently डील की है. Next one please. हाँ, so ये श्रेया नाम की लड़की, I have taken just this case, only one I have taken because I want to highlight this specific disorder which is maybe we are going to see in the next few months, and many of us may not be aware of this disorder, which is called as post-traumatic stress disorder. ये जो श्रेया है 17 साल की, उसे लेके आते हैं उसके फादर. Her mother has died of COVID 4 months back, and she has repeated violent outbursts, refusal to attend classes both online and offline, lot of emotional issues, crying spells, inability to sleep, ड्रीम्स, नाइट टेरर्स भी उसको आते हैं 1 महीने से. अगर ये ऐसे होता है तो हमको क्लियरली दिखता है कि शी हैज इमोशनल डिस्ट्रेस. लेकिन अगर हम ज्यादा हिस्ट्री लेते हैं, जिसको हम बोलते हैं हेड एसेस, आपको भी शायद थोड़ा थोड़ा इसके बारे में पता है कि हम होम, एजुकेशन, एडिक्शन, ड्रग्स, इन सब चीजों के बारे में पूछते हैं. ये पूछने के लिए आपको कम से कम आधा घंटा लगता है. लेकिन अगर ऐसे स्ट्रेस इस टाइप के सिम्टम्स अगर दिखे तो मे बी ये बच्चों को आपको थोड़ा ज्यादा समय देना पड़ेगा, या एटलीस्ट एडोलेसेंट पीडियाट्रिशियन के पास या कोई एक्सपर्ट के पास रेफर आप कर सकते हैं. पर आई वांट टू गिव यू दैट कॉन्फिडेंस कि इवन इन योर ओन cities and areas or towns and villages, we must now focus on people like us who are non-psychiatric academicians or clinicians, but we can still be confident enough to use few drugs, just 2 or 3, which will not only help our adolescents, but which will also help us to find a new role in our own life. तो हेडेसेस ने समझा ऐसे कि न्यूक्लियर फैमिली है, ओनली चाइल्ड है, she lost her mother, but she doesn't have similar episodes in the past. That tells us that this is of recent origin. Bright लड़की थी, preparing for NEET, passed her 10th with 94% marks, has occasional skipping of meals, thinks she has her own image that she is overweight for her age. She's very social, but recently she has stopped mixing with her friends and watches lot of OTT platform serials and movies for long periods in the isolation of her room. Next one, please. So, अगर इसमें हम red चीजें देखते हैं तो ये एक salient हमको idea देते हैं कि ये बच्चे का क्या है. So, there are very few physical symptoms, but lot of symptoms of distress in terms of disturbed behavior. उसका डेली फंक्शनिंग यानी स्लीप, शेड्यूल, स्कूल, ये तीनों चीजें अफेक्ट हुई है. और हम हमेशा कहते हैं कि अगर मूड में चेंजेस जैसे एग्रेशन है या फ्रीक्वेंट इमोशनल आउटबर्स्ट है या क्राइंग स्पेल्स है, अगर वो 2 हफ्ते से ज्यादा आते हैं बच्चों में और वो स्लीप, ईटिंग, फूड ये चीजें अफेक्ट करते हैं डेली रूटीन में, तो वो डेफिनेटली रेड वार्निंग और सिग्नल फॉर अस टू प्रोब डीपर एंड स्टार्ट थिंकिंग अबाउट ट्रीटिंग इट. तो 4 महीने पहले हुए, ये 4 महीने पहले का सिग्निफिकेंस ऐसा है कि पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर, हम सबको पता है कि कोई किसी पेरेंट का लॉस बच्चे को बहुत ज्यादा स्ट्रेस देगा, लेकिन ये स्ट्रेस एक्यूट और इमीडिएट रहता है और वो कुछ हफ्तों में या कुछ पहले 1-1.5-2 महीने में खत्म हो जाता है और बच्चा धीरे धीरे फिर से नॉर्मल ट्रैक पर आता है. पर अगर बीच में कुछ गैप रही और उसके बाद 4 महीने के बाद अगर बच्चे को इमोशनल डिस्ट्रेस दिख रहा है एंड शी इज सेइंग दैट शी कैन नॉट forget the funeral or whatever funeral they were last, the bidding adieu जो बोलते वो उसने अपने मम्मी के साथ किया है, उसका एक डिटेल वो भूला नहीं सकती है और वो फ्लैशबैक करके उसके मेमोरी पे आता है, मेमोरी में आता है एंड देन शी कैन नॉट फंक्शन. फिर वो क्लास नहीं कर सकती, वो पढ़ नहीं सकती, बार बार ऐसे बोलती है कि मेरे मदर के डेथ के लिए I am to be blamed because I did not phone up that particular doctor who could have saved her. She actually relived the entire episode again and again and is not able to control it on her own. Yes. Next one, please. तो अगर ये हमको दिखता है तो it could be depression, it could be anxiety, it could be even some problem in our, हमको ये पहले देखना ही पड़ता है कि कुछ physical issues तो नहीं है, thyroid का कुछ problem तो नहीं है. और ये जो टेस्ट मैंने दो लिखे हैं, स्कैरेड और बीडीआई. स्कैरेड इज अ टेस्ट फॉर एंजाइटी, बीडीआई इज अ सिंपल टेस्ट फॉर डिप्रेशन. और दोनों के बहुत ही सिंपल और फास्ट होने वाले छोटे छोटे टेस्ट हैं, freely available on net. Anybody can keep it in their OPD, and just while the parents and children are sitting in the OPD, and if you find that there are few signals, few warning signs, just give them that and ask them to fill it up. And if you get a particular score, you are almost sure that this child needs proper treatment and referral. तो ये उसमें डिप्रेशन है कि एंजाइटी है, इसके लिए मैंने ये दोनों टेस्ट दिए थे, पर दोनों में मिनिमल सिम्टम्स दिखे. तो आई थॉट बिकॉज शी हैड दैट फ्लैशबैक एंड दोज इंट्रूसिव मेमोरीज, और वो अवॉइड करती थी अपने मदर के रूम में जाना, या मदर का कुछ भी उसको दिखता था तो शी यूज्ड टू गेट इमोशनल अपसेट. सो दैट indicated that probably this is post-traumatic stress disorder. So even after a gap of 4 months, that the adolescent was not able to forget how she had coped with that particular memory. Yes, next one please. तो ये PTSD क्या होता है, किनको होता है? ज्यादा बच्चियों में होता है, ज्यादा औरतों में होता है, and especially those who are LGBTQ, we see that more in them, and all those who have faced some kind of emotional disaster in past few months. It could be war, it could be some abuse or loss of a dear one. What the typical symptoms are? Flashback. श्रेया को सब था, फ्लैशबैक था, अनवांटेड मेमोरीज थे, नेगेटिव मूड्स थे, और स्टार्टलिंग, थोड़ी सी कुछ कहीं कुछ आवाज हो गया तो शी यूज्ड टू गेट अपसेट. शी हैड लॉट ऑफ एंजाइटी, स्लीप इश्यूज, अवॉइडेड क्लासेस, and she was trying to get herself detached and isolated in her own room. Look at the beauty of this word post. Post का मतलब है it has to have occur after a particular trauma, maybe after a gap, and it should continue at least for 4 weeks. So Shreya was having these symptoms for past 1 month, and symptoms should also last for a longer time, that is up to 4 weeks. तो ये 4 नंबर PTSD में इम्पोर्टेंट है. इसका बायोलॉजी अगर हम देखें तो इसका सिंपल आंसर या सिंपल एक्सप्लेनेशन ये है कि द मेमोरीज वर नॉट प्रॉपरली, the functioning of amygdala and the hippocampus malfunctioning कहीं तो है, तो मेमोरी का जो प्रोसेसिंग होना चाहिए वो ठीक से होता नहीं है. And because of this they have lot of arousal issues, avoidance issues, mood issues, and flashback and remembrance, which causes intrusion in their day-to-day functioning. Next please. So we'll skip that because DSM may be a little bit more for you. पर इसमें ये ध्यान में रखना है कि flashback है, daily functioning को affect कर रहा है, memories है which she cannot forget, and there is lot of avoidance and isolation. अगर ऐसा है तो it could be PTSD. इसका definitive answer हमारे पास है, लेकिन problem ऐसा है कि सिर्फ 60 to 70% show success even after treatment for few months. ये CBT जो लिखा है वो cognitive restructuring है. That means you have to change the way she thinks, and accordingly she will have change in her mood. There is one more very specific thing which we have to do for such adolescents is exposure and desensitization. इसका मतलब ये है कि अगर वो उसके मॉम के कोई भी चीज को टॉलरेट नहीं कर सकती तो उसको वो रूम तक ले जाना and then give her some relaxation. फिर दरवाजा खोलना, give her some relaxation. Then let her enter with one foot, give her some relaxing technique. So likewise, for every small exposure, we have to keep on giving her exposure followed by relaxation, so that she gets systematically desensitized and finally she can tolerate all those memories. And there are very good drugs, anti-anxiety drugs and antidepressants. I put her on fluoxetine 20 milligrams twice a day, and also, yes, only these two, twice a day. So we have to remember, when we are looking at our way forward, that even pre-COVID, many of these adolescents had a need for some mental health support, probably which we have not given them, and they remain masked. 50% of all psychiatric disorders start in adolescence, and therefore we have to be careful in catching them early. Symptoms of emotional distress, if they last for more than 2 weeks, it is mandatory for us to give it a deeper thought and not just tell that she will get over it. Adolescents often resort to faulty ways of handling stress, like they will go for screen abuse, or they'll go for substance abuse, or they will try to go into something which is not good for their health, both physical and mental health, or they try to relieve stress by going for something which will excite or stimulate them just to get out of the stress. And therefore their stress symptoms have to be carefully looked at. Many somatic symptoms are signs of distress. Adolescents who are at a turning point of their career are more worried, so we have to take them as a vulnerable group. And finally, we all have to change the negative attitude and move towards this way in a positive manner. Next one, please. So we have to decide. Yes, next one. We have to decide how we can empower the schools, the teachers.
We will wait. She will rejoin. We can wait for a few seconds. Yes.
No,
yes,
no, I have logged in again. Yeah. So we have to think of integrated mental health now. And just now, recently in Pedicon, in a panel discussion, I tried to impress that we need to take care of our adolescents by providing care in every school and trying to go to them in groups, either through screen or off screen, and try to take action now. ये बहुत सारे discussions on screen dialogues बहुत हो गए. Now it's the time for action, and we have to all go into an action mode and see what we can do at our level, a small group, with our neighbors, with our adolescents who are of our friends, their children, their adolescents, or in any community where we can work, so that at least some mental health awareness and some concern for their psychosocial issues, the teachers and parents are made aware of. Even creating awareness can help us them a lot, so that we can prevent abuse and become their watchdog. And we have to be now recovery focused and strength based techniques that we will have to adopt. Next, please. So we need to empower parents in terms of giving them a media diet. सबको ये पता है. Let they themselves have some me time, some spacing out, and sharing their worries. Steps what every parent and each one of us can think of. What one thing I can do to better the physical and mental health on a daily basis? What empathic thing I can think of to help and show and model for the adolescents, so that they are seeking joy from helping others. How I can equip myself to catch the early warning signs, and what are the small windows of anticipatory guidance that I can give in my clinic. So if we can think of this, talking to the parents and adolescents, even for a brief period of 1 or 2 minutes, that is going to help them. Next one, please. Of course, all of us need to be updated, catch them early, more resilient. All of us need to learn at least few of the counseling skills like better listening, being more empathic, and letting children and adolescents give a way of expression so that we can connect to them. We ourselves also need to de-stress ourselves by donning a new hat of being a counselor, because if you can help and enrich even one life of an adolescent, I feel that's a great enriching achievement even for all of us as pediatricians. So let us all be advocates for their safety and continuity in their world. Next one, please. Care is creating awareness about resilience. We all need to focus only on must know. Keep telling the parents, tell them that this is a smart generation. We have to put smart goals in front of them, and meetings are, lot of them are happening, but it's a time for action. Take help of all the tools, technologies, and NGOs, and all of us need to give each other a lot of hope. Next one, please. These are some sites which will help you, like Nimans and others, which give very good learning material for your own self-learning. Next. So all of us have known this. I need not enumerate them again. Let's move to the next slide. Viruses are ancient and we are modern. And we are all people who have fought many tougher battles in our ancient past. And we are all trusting science, trusting vaccines, trusting medicines, and we have also made the community to make trustworthy scientific decisions with the past 2 years and all that the community, parents, adolescents have gone through. So let us move from the comfort zone, which hampered us for some time. We went into discomfort, but let us now move into growth zone. Next one. Next. Avoidant बच्चे रहेंगे, जो रिएक्शंस उनकी कंफ्यूज रहेगी, या कोई भी इंजर्ड बच्चे रहेंगे इमोशनली, तो उनको हेल्थ की तरफ ले जाना है कि उनको निग्लेक्ट करना है, ये हमारे हाथों में. So we have to look at this continuum and we have to decide whether we want to go towards green or red. Next. There are always two types of human beings. Negative ones, parents who show their children and adolescents, if you do not study, you would end up like him. And if you study well, you will be able to make a better world for him. तो शायद अगर सरल हो तो दूर चल के देखे, जरा हम तुम बदल के देखो, जरा हम बदल के देखो. Thank you.
Thank you, Dr. Shubha Khirwadkar. And it was an extensive elaboration of present problem. May I request Dr. Wankhede sir to say a few words?
Very much elaborative, very informative, eye-opening rather for us. Excellent lecture by Shubhada. I really thank you. Thank you for enlightening us. Thank you very much.
Thank you.
Shall we ask few questions, because
Yes,
actually
we should
the
start.
time is means our 1 hour is over.
Yes.
Yeah.
Madam, we have kept some slot for question answer only,
Okay.
so that all the queries will be solved.
Shall I ask one question, ma'am?
Yeah, please.
So your guidance about sleep hygiene and gadget use.
Right. So all of us have now become aware towards sleep hygiene. और बहुत सारी चीजें तो हमको पता भी है, but just to enumerate them, बेड टाइम रूटीन जो हमारे यहाँ बहुत कम बच्चों को सिखाया जाता है, वो अभी एटलीस्ट जिनके बच्चे छोटे हैं उन्होंने ये शुरू करना चाहिए, ताकि द children and later on the adolescents become adept to ways of making a good sleep routine. Especially sleep is important for adolescents because they require it more than the adults, that is 8 to 9 hours of sleep. तो ये अच्छी स्लीप आने के लिए जो हमारा रूटीन है कि अच्छा एक्सरसाइज होना चाहिए, अच्छा न्यूट्रिशन होना चाहिए, कम स्पाइसी फूड मील्स के में लेना चाहिए, या बाथ हॉट वाटर बाथ करना चाहिए, so there should be a proper way of going towards sleep. If we as parents role model this, then it is easier for children and adolescents to do so. हम लोग ये बहुत बोलते हैं कि बेडरूम्स में फोन मत ले जाओ, बेडरूम में टीवी मत रखो, तो अगर ये हम सब नहीं करते तो we have no right to keep on stressing upon our adolescents or giving them doses of our advice if we do not follow sleep routine. तो एक मैं इम्पोर्टेंट यहाँ चीज बोलना चाहती हूँ कि स्लीप रूटीन में एक बहुत ही इजी टेक्निक है जो अगर हम सीख सके और बच्चों को भी सिखा सके तो वो बहुत इजी है, और एनी एडोलेसेंट कैन डू इट वेरी रेगुलरली. उसमें ऐसा रहता है कि यू जस्ट प्रोग्रेसिव रिलैक्सेशन टेक्निक ऐसे इसको बोलते हैं. इसका बहुत अच्छे वीडियो
in between, may I request any other person want to ask? Please keep ready.
Yes, madam, I want to ask one question.
इसमें जो PRPM, yeah, please. Okay. Yes, Dr. Wankhede.
Yes, madam. What is refractory depressions? How to tackle it?
No. Refractory depressions are depressions which are not showing results in the expected time and in the expected dose. So if that happens, many times when which other drug you are using for depression? Any one of you are using it? Antidepressant कुछ देते हैं आप लोग?
Sometimes we do give. Yes.
Which drug do you give routinely?
Imipramine, tricyclic antidepressant we are giving.
Okay, no. Now there are many better drugs available. So SSRI जो बोलते हैं serotonin uptake inhibitors जो रहता है, तो वो a very common drug and very drug which gives good results both for anxiety and depression is fluoxetine. So Fludax करके, yeah, so 20 milligrams. So that is the usual drug we give. So उसका देने के बाद within say 1 month, 1.5 months, you definitely see changes in terms of better functioning and better mood. But अगर ये दिखता नहीं है तो इसको रिफ्रैक्टरी के तरफ जाने वाला हो सकता है, ऐसा हम सोचते हैं, and then it is a domain of a psychiatrist. So I always say, remember that you are not going to treat each and every psychosocial or mental health issue. तो क्या हमारे कंट्रोल में है और क्या हम कर सकते हैं उतने, जैसे एंजाइटी है, डिप्रेशन है, PTSD है, ये हम लोग आराम से ट्रीट कर सकते हैं, पर जिन चीजों के लिए हमें साइकियाट्रिस्ट का ओपिनियन लेना जरूरी है, वो चीजें हमको उनसे रेफरल लेके ही कंटिन्यू करनी चाहिए. So keep a good psychiatrist in loop and refer and then continue with his treatment and then your counseling.
Yeah, a nice one. Ma'am, your advice about addictions by peer pressure.
Yes. So obviously peer pressure is a big factor in any kind of addiction, be it substance abuse, alcohol, smoking, or even screen addiction, right? So if these addictions are to be tackled at level of the peers, then we have to teach our adolescents many social resistance skills, या जिसको हम life skills बोलते हैं, जिससे how to say no, how
Yes,
to
ma'am.
say
Please elaborate. Please elaborate how to
right.
say no.
Yeah, right. How to say no. So how to say no के 10 steps, और जब ये हम इन पर्सन लाइफ में सिखाते हैं बच्चों को या इवन स्क्रीन पे सिखाते हैं, तो ये सब 10 उनको एक एक करवाते हैं, सो दैट दे आर एबल टू अंडरस्टैंड. क्या अरे are you able to see me?
We are not able to see you,
No.
but we are able to hear you. Continue, ma'am. We are
Okay,
able
that
to
is
hear
good
you.
enough.
Yeah.
या राइट. तो जैसे सेइंग नो के जो मैंने स्टेप्स बताए कि पहले एक नॉर्मल नो कहो, फिर फोर्सफुली नो कहो, यानी बार बार रिपीटेडली नो. कोई भी डिफिकल्ट सिचुएशन में जहां आपको टांट मारे जा रहे हैं, जहां आपको प्रेशर आ रहा है, जहां हमको कोई बोल रहा है कि तुम मर्द नहीं है क्या, ऐसे कैसे, इतनी छोटी सी चीज नहीं कर सकता क्या, उस समय किस तरह से वो नो बोलना है, ये हमको बच्चों को एक्चुअली सिखाना पड़ता है. हाउ टू कीप आई कॉन्टैक्ट, हाउ हैज टू बी योर बॉडी पोस्चर, हाउ योर एंटायर फेस शुड शो दैट यू आर असर्टिव इन सेइंग नो. जैसे नो का मतलब नो है, जो हमने पिंक मूवी में बहुत फेमस हो गया है डायलॉग, नहीं का मतलब नहीं ही होता है. तो ये सब उनको अच्छी तरह से सिखाना चाहिए. और ये एक बार आपने देख लिया, इवन एडल्ट, pediatricians, parents, they can easily teach these skills to their adolescents so that ऐसी सिचुएशन में पतली गली से कैसे भागना है, कैसे सिचुएशन को अगर आपको एक्सक्यूज देना जमता है तो एक्सक्यूज देके वहां से जाना है, या कैसे ऐसे सिचुएशन में मैं जाऊं ही नहीं, इसके लिए खुद को अवेयर करना है. ये सब चीजें हम आराम से बच्चों को बता सकते हैं. तो कोई भी ऐसा अगर पीयर प्रेशर वाला आप न्यूज सुनते हैं या कोई इशू डिस्कस करते हैं डाइनिंग टेबल पे, तो उस समय ये चीज आराम से बच्चों को बताई जा सकती है, जिससे उनको ये नो वाली स्किल्स आ जाए. तो इसमें 3 चीजें इंपॉर्टेंट रहती है एक्शन में. फर्स्ट इज टू से नो, सेकंड इज प्रॉब्लम सॉल्विंग, यानी हाउ यू आर गोइंग टू डील योर मेंटल स्ट्रेस. इवन प्लेजर सीकिंग अगर हमको करना है तो द हेल्दी वेज ऑफ सीकिंग प्लेजर एंड सीकिंग जॉय. तो ये सब लाइफ स्किल्स में आता है. एंड आई लाइफ स्किल ट्रेनिंग इज द वे इन few months we are going to have to give to our children so that they become more able to cope with the situations that they are going to face in the months ahead. Right.
Yeah. Dr. Wankhede, you wanted to ask something?
Madam, I just want to know, can we use melatonin as a double for double use, for example, antidepressant as well as sleep disorders? In case
its
of
use has been documented. I have not used in any way, either sleep issues or for as an antidepressant, but its use is quite well documented.
in sleep disorders?
Yeah, even in sleep disorder. जैसे हम यूजुअल जो बोलते हैं कि कैफीनेटेड ड्रिंक्स अवॉइड करो, सूदिंग लाइट रखो, म्यूजिक लगाओ, so all these sleep routines, if the family keeps, most of the sleep issues are automatically addressed.
Thank you, ma'am. Dr. Manju, you wanted to ask something? Any of the participants? Or shall we head for the next point, like giving vote of thanks?
Manju is on board.
Yeah. Okay, over to Dr. Sagar Khedu to give away vote of thanks.
Sagar sir, you are on
Sagar, you are mute. Please
Yeah.
unmute.
Sorry, ma'am. Ma'am, yeah. Ma'am, mental health status of the children, which were went into the huge transition in last 2 years because of the COVID, and where they had experienced another option of online learning, and again they are going back to the schools. So there will be definitely, there will be definitely, it will be not that easy for the children to be go back to their normal schooling. Well, this point and another many points has been addressed very well by our Dr. Trivarti ma'am. I will very much I will be thankful, ma'am, for presenting a nice presentation and solving many problems and many question that we had in the mind. As this is a topic we are not experiencing. I mean, this is a topic we are. I mean, this is addressed by you very well. Well, the letter Maha-IP President Sir Gangulia sir is there. I think I'm very thankful to you sir. Then again, the moderating a session which is which have a topic which is very offbeat topic, which is not in a we are using in a routine practice, which has to be moderated very well. I think Dr. Chitra Kulkarni ma'am, you are done very well. I'm very thankful to you. Again, Neha madam and Vishal sir, they are definitely they are many times they works on the for presentation, and because of them we are here as a digital presentation. I'm very thankful to you both, sir. Then finally is our President Dr. Pramod Wankade sir, who are taking a lot of efforts to take such a topics which are different and which are which are definitely offbeat topics, which are definitely we like to hear much and more. I think in the last 1 week we had presented, we have had 4 such presentations, and I'm very thankful to you, sir. To all my seniors and colleagues who were there for this presentation, I'm very thankful to you. Okay. Thank you.
Thank you.
Yes.
Thank you.
Yeah.
And
Yes.
thank you, Pramod, thank you, Jayashree. It was wonderful being with all of you, Dr. Sagar and all, Dr. Hemant Gangolia, Dr. Dabadkar sir. Thank you, IIT Raigad and AHA, for giving me this opportunity to be connected with you and share my views. Thank
Yeah,
you.
thank you.
Thank you,
ma'am.
Subhadra.
Yeah.
Thank you for accepting
Just
our
one
invitation.
sentence which is very important from your lecture. What I got, this is the zest of your lecture, that the attitude of a person is a mental filler. आपण या जगाकडे कसं बघतो ती खिडकी असते आपल्या ॲटिट्यूड. अँड सो what we see, we experience. And we experience the world in that way where we may not be able to change the world, but we have to change our attitude. Being positive in your mind, definitely the actions will be more purposeful. आणि या चांगले विचार जे चांगल्या कृतीला जन्म देतात, त्यामुळे मेंटल स्ट्रेस निघून जातो. Always think in your mind that when there is a setback, it opens a door for new opportunity and for growth. Thank you, Dr. Shubda, for being here for Raigad IIP. Thanks.
Chitra madam, just for a few minutes, I would like to, or rather request Dr. Subhadra for elaborating about her project at Melga.
Definitely, we are also interested.
Yeah.
A great social work. Please
Yeah.
tell us.
Right, so I'm sorry for the network glitches that occurred, because of which I could not myself manage the presentation. And Dr. Bhandar, thank you to you also for helping me out. Actually, I am in a very remote area of Melghat, which is a region near Amti of 300 small villages, and यहाँ पर महान के जो है जहाँ Dr. Satav has been working for past 20 years, और यहाँ पर हम लोग बहुत सारे प्रोजेक्ट बच्चों के लिए करते हैं, कुछ बड़ों के लिए भी हैं, but most of these projects are related to malnutrition because this area has the highest rate of malnutrition that among children. और जो हम काम कर रहे हैं जहाँ 0 to 5 में कम्युनिटी रिडक्शन ऑफ मॉर्टेलिटी, ये हमारा एम है, तो उसमें हम लोग अलग अलग प्रोजेक्ट्स के साथ वो मॉर्टेलिटी कम करने की कोशिश कर रहे हैं. One of them is providing local therapeutic food, LTF जिसको बोलते हैं, to all the children who are either SAM, severe acute malnutrition, और severely underweight. तो उनके लिए एक सम्मान नाम का हम प्रोजेक्ट चलाते हैं. सम्मान इज सैम मैनेजमेंट, तो सैम एंड मैन ऐसा मिला के उसको सम्मान किया है. तो वो एक प्रोजेक्ट के लिए मैं प्रोजेक्ट डायरेक्टर हूँ. और एक प्रोजेक्ट हम चलाते हैं जो जिसको कहते हैं हम सेहत, स्ट्रैटेजिक एनहांसमेंट ऑफ हेल्थ अमंग एडोलेसेंट्स इन ट्राइबल एरिया. तो इसके 6 मॉड्यूल्स है, उसमें न्यूट्रिशन से लेके रिप्रोडक्टिव हेल्थ तक अलग अलग मॉड्यूल्स है जिसको हम एड्रेस करते हैं थ्रू ट्रेनिंग. एंड वी हैव अ नेटवर्क ऑफ 100 विलेज हेल्थ वर्कर्स जो गांव-गांव में जाकर ये हमारा प्रोजेक्ट चलाते हैं. तो दे आर एक्चुअली द पीपल हु आर वर्किंग एट द ग्रास रूट लेवल. हम लोग सुपरवाइज करते हैं, हम भी फील्ड में जाते हैं, बट उनके ऊपर सुपरवाइज करने के लिए फिर मेडिकल सुपरवाइजर्स है, उसके बाद डॉक्टर्स है, उसके बाद मैं. ऐसा वो पूरा नेटवर्क है. और वो प्रोजेक्ट हम कई सालों से मैं रिमोटली उसमें हेल्प कर रही थी. नाउ आई एम एक्चुअली गोइंग 4 days a week to Melghat, which is 6 hours journey from Nagpur, and it is a whole ghat and रास्ते का र भी नहीं है, ऐसा एरिया है. तो वहां पर काम कर रही हूँ. तो मैंने ये सोचा था कि
शुभदा आम्हाला तिथे जाऊ.
अलग करूंगी, तो मैंने अपने जीवन में नॉवेल्टी इस तरीके से लाई.
एक्सलंट एक्सलंट. बट आम्हाला पण तिथे शेअर करायला आवडेल किंवा बघायला आवडेल. इन द मंथ ऑफ एप्रिल फ्रॉम 17 to 24 आय एम इन अमरावती फॉर birthday of my nephew. So I would like to attend there. त्या पिरियड मध्ये तू आता तिथे.
यू ऑल आर इनवाइटेड. और आप लोग अगर कुछ इन बच्चों के लिए या हमारे विलेज हेल्थ वर्कर्स के लिए ट्रेनिंग के टर्म्स में उनको नई चीजें बताने के लिए या ऐसा कुछ भी कर सकते हैं. ये जो हमारे ट्रेंड विलेज हेल्थ वर्कर्स हैं उनको हमने पिछले 10 साल से ट्रेन किया है. मेनी ऑफ देम हैव आल्सो वन नेशनल अवार्ड एट नेशनल लेवल. तो उनको नॉट ओनली नियोनेटल रिससिटेशन, अम्बू बैग, सब कुछ वो यूज करते हैं.
Actually same type of tribal are suffering from malnutrition here also. तर त्या प्रोजेक्ट मधनं काही आम्हाला आयडिया इथे घेता येईल का? इथे पण आम्ही असं प्रोजेक्ट.
तर तुम्ही नक्की या. डॉक्टर सातव तुम्हाला व्यवस्थित गाईड करतील. त्यांना खूप अनुभव आहे, 24 वर्षांचा अनुभव आहे त्यांचा. आणि म्हणजे हाच प्रयत्न त्यांचा असतो की
आणि माझी तर अशी इच्छा आहे की जर शक्य असेल आणि सगळ्यांनी जर मला कॉपरेट केला तर वी कॅन हॅव अ 1-2 days trip there so that we can see directly there, we can go there.
Chikaldara is just 25 kilometers from here.
Yeah,
so you can have a camping at Chikaldara and then move.
बघूया आपण कसं करता येईल. तर एक ट्रिप करूया, 2-3 दिवसाची ट्रिप करूया. तिथे मॅडमच्या प्रोजेक्टवर जाऊ शकतो आपण, चिखलदराला जाऊ शकतो. आणखी मेळघाटचा धारणीचा भाग जो आहे ट्रायबल एरिया तो आपण बघू शकतो. वैरागडला डॉक्टर कोल्हे म्हणून एक हे आहे, मागे आपल्याकडे आले होते ते. So he is working there since so many years. He has devoted his life, whole life to this tribal for service ट्रॅव्हल सर्व्हिसेस.
आता सरांनी ते काम थांबवलंय, म्हणजे ते आता
अच्छा, हा हा,
वगैरे
आता कुठे?
चालतच नाही.
इज नॉट
काही
देअर.
नाही.
अच्छा
He is here, but he is more into agriculture now.
अच्छा, ओके ओके. तर बघूया, हा
डॉक्टर
मी
सातव आणि डॉक्टर कविता सातव यांना नक्की भेटा.
प्रपोजल
खूप चांगलं
मांडतोय
काम आहे.
आणि एक 2 days ट्रिप आम्ही शक्य आहे का ते, कारण की इथनं खूप दूर पडते ते, जायलाच आम्हाला जवळजवळ एक दिवस लागेल, परत एक दिवस यासाठी आणि मग एक दिवस थांबायला, असं काहीतरी आमचा 3 days प्रोग्राम करावा लागेल. लेट अस सी.
डॉक्टर सातव जे आहेत ते MD मेडिसिन आहेत आणि मिसेस सातव इज अन ऑप्थॅल्मॉलॉजिस्ट अँड दे आर
अच्छा.
डुईंग एक्सलंट वर्क.
बट
म्हणजे
वेअर दे आर,
माझं
इट इज नियर बाय बैरागड.
इट इज नियर धारणी. धारणी इज अ
अच्छा, धारणी इज द डिस्ट्रिक्ट प्लेस, दॅट इज अ तालुका प्लेस.
तालुका. या धारणी
Great
तालुक्यात
Yeah.
अमरावती. आणि सरांनी लास्ट 2 वर्षामध्ये जवळपास 700 कोविड पेशंट वाचवले. आमच्याकडे 10 व्हेंटिलेटर्स आहेत.
Oh my God.
आणि
Great.
खूपच जोरदार काम आहे सरांचं. म्हणजे माझं काम
एक्झॅक्ट
काय,
प्लेसचं नाव काय त्या गावाचं?
उतावली म्हणून एक गाव आहे. उतावली.
कुठलं? उतावली.
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 तर सरांना भेटायला नक्की या. मी तुम्हाला म्हणजे ऑन
नाही,
स्क्रीन कनेक्ट करायचं.
मी तर येणार, एप्रिल महिन्यामध्ये मी येणार. आय विल बी देअर. नक्की येणार मी तिथे. कारण मी 17 ते 24 तारखेपर्यंत अमरावतीला आहे. Meanwhile, I will be there.
Yes. Yeah, thank you. May I request Neha to share some live chat from YouTube or some questions? Was it there, Dr. Neha?
Yes, ma'am.
Are there any live chats from YouTube?
Uh,
We went on live. We went live on YouTube.
We weren't. Okay.
Yeah.
Okay.
Okay. Shall we stop the recording then?
मला ऍक्च्युली